Following a CO2 fractional laser ablation of your face, the most important thing to remember is that the more moist your skin is, the quicker it will heal. If you let your skin dry out by not applying enough Vaseline or ointment to your skin, the longer it will take to heal and the risk of grid patterns is higher. That's the basic message I want you to definitely take home, is that make sure you always apply enough Vaseline to your skin. Straight away after your treatment, you will have been given some elastin skin nectar on your skin, as well as the Vaseline, and then you will have also been placed under the LED phototherapy Omnilux red light, red wavelength, to facilitate healing and take down inflammation. We would like to see you for the next 5 days to monitor your progress and also provide you with the Omnilux red LED phototherapy. Now, it's very important to appreciate that the clinical red LED phototherapy that's in our clinic is the one that's used in hospitals around the world when treating skin cancer patients or eczema or psoriasis patients. It's a very different level of energy and power output than the home devices you can buy on Amazon or online. There's no comparison. And with patients who've used home devices and the patients that have come to us for their LED phototherapy, the recovery speed has been dramatically different. We've also sped up the recovery process by introducing elastin skin nectar, which is the first topical agent in the world designed to speed up recovery following laser treatments. So when you go home, all you need to remember is you don't wash your face, you just apply Vaseline. When the Vaseline is dried out in the morning, so from overnight, the Vaseline is dried out, you put on elastin skin nectar liberally, and then you apply the Vaseline. And then if it dries out during the day, you apply Vaseline and again. I don't want you walking around with this thick layer of Vaseline, but you just don't want your skin or any patches of skin to be dry. Okay? And then in the evening, just before you're applying your next Vaseline, you apply skin nectar again. So you need to be applying elastin skin nectar twice a day, just before you layer up with some more Vaseline. You are likely to be feeling very warm, very hot, and very swollen. What you can do is use some cold compression, so some partially defrosted cold packs, some cold air. If it's nice and wintry, you can go out for a cold walk, and this will help reduce swelling and reduce the heat that you're burning off. There will also be some blood dots, some blood scabs coming through, and you can dab those off if you want with a clean cotton bud, but my advice to you would be just to apply the Vaseline, and then we will see you the next day, and if necessary, we will do that cleansing process for you. It's so important not to rub the scabs off, to scratch them, despite how itchy they may feel, or to scratch the area or to pick at scabs. If you are getting really irritated by some itching, let us know. We can prescribe you with some antihistamine, which will make that a lot more comfortable for you. If you have any antihistamine at home, please use that. It's absolutely fine to take pain medications if you need them. Most people don't. It's not pain that they're concerned with. It's the redness, irritation, and the grease on their face. But if you do want to, I prefer you to paracetamol or codeine rather than Nurofen or any other anti-inflammatory. The reason being that the anti-inflammatories are going to slightly suppress the collagen stimulating response, which we're trying to achieve following your laser treatment. Needless to say, you're not going to be going outside much this first week, so I'm sure you're not going to be applying makeup. There is absolutely no need to apply sunblock while you're using Vaseline and you're not going out much. Do write down a list of questions for you to ask your therapist the next day during those first 5 days. Most people go through a significant psychological journey during their recovery. They fear that they're never going to look normal again. They regret what they've done. They're nervous what their family may think or friends may think. But if you follow the protocol which we suggested and we implement, we're quite confident you'll be able to wear makeup a week after your treatment. Okay, yes, it'll be about 7 days before you can apply makeup. So that's going to be about 7 days before you stop using the Vaseline on a regular basis, especially during the day. So you'll be able to wear makeup and you should be able to go back to work 7 days post your treatment. Some people, it takes a little bit longer, but that's the case for most people. Now, in the long term, after that first week where you are applying makeup and Elastin Skin Nectar, I would still apply a layer of Vaseline overnight just to stop it from dehydrating overnight, because the skin hasn't fully healed at a week. It's healed enough for you to return to normal activities. If you want further care from us, I would recommend at least a twice weekly Omnilux treatment. And if you can only manage a week, that's better than nothing. But that will certainly help your skin recover quicker and better. It's about reducing the redness and stimulating collagen. Remember, you've invested a significant amount of energy and money and time into rejuvenating your skin, and let's make sure you look after it properly. So that means that once you've stopped using Vaseline and you are going outside, I want you to use at least an SPF 30 every morning. And if you're in a sunny environment, you need to reapply that if it dries up. Okay? It's very simple. Look after your skin. Make sure you hydrate. Make sure you have an excellent topical skincare program. This can be restarted usually after the Vaseline has stopped. So after a week. The Elastin Skin Nectar, which we use, is a great product at healing and also rejuvenating your skin on its own. So holiday advice, don't go on sunny holidays for at least 30 days. Make sure you use a factor 50 if you're going on a sunny holiday. Stay in the shade. Do not sunbathe. I prefer if you're a zinc sunblock on your face if you're going out on a sunny holiday. And avoid spray tans, fake tans. You will not need an exfoliation for at least 3 months. Just gentle skincare will be good enough for you. Your home care routine will be fine. For deeper scars, for deeper wrinkles, some people require a second treatment, and that could be done at about 6 months. If you have any questions that I haven't addressed in this video, please do message me or leave a comment below. If you've liked this video, do give it a thumbs up, and I would really encourage you to subscribe to our channel for further advice following any aesthetic treatments that you may have had at Riverbanks.